distributed throughout the community. And there's about 7 million pounds of food that comes through the Clark County Food Bank. 2 million pounds of that is from 25, 30 grocery stores. So when this kind of food grocery store craze hit us all in mid-March, a lot of the food that used to be left over, didn't sell, was sold. And so that resource kind of dried up pretty fast. Didn't go down to zero, but was cut to maybe 30% of what it had been. And then we reacted quick by saying, well, let's buy food. And then we couldn't find food. You couldn't buy truckloads of food really almost anywhere with a delivery time of anything inside of a couple of weeks. All that has leveled out. But the food supply chain really was kind of crazy and was something that we had to overcome due to the virus. Also, as Carolyn mentioned, volunteer groups changed. A lot of folks that were concerned about their health as they should be, or were elderly or caring for others, or just didn't feel comfortable, dropped away. And some of those were our very best volunteers. And then that gets kind of compounded with groups going from 150 on our Tuesday night repacks down to 15 or maybe 20 at the most, if we can space them throughout the warehouse. And you kind of add on to that about, we do 5 full facility sanitations a day. And that's not a small thing. And we're spraying, I don't know, I think about 2.5 to 3 gallons of disinfectant a day over pretty much everything. So including ourselves sometimes. And so just these interruptions with volunteers have made it really difficult to get the work done. Last year, we had about 68,000 hours of volunteer work. So we're very much dependent, like I think all of our organizations are, on heavy volunteers. And when that just kind of got, the landscape of that got changed, it was a lot of retooling. And then distribution, of course, and Carolyn told you about that. There's not the shopping style pantries that a lot of our partners use anymore that can work, because it puts you close to people and has you touching the food. And so now it's mostly pre-packaged box distribution. But we're doing that quite a bit differently. We're going to a number of places that didn't have a resource in the past, and now we go to those places. We'll probably stop going to those after the crisis unless there's continued need. We do a drive-through distribution in our facility now twice a week, mostly because we end up with a lot of perishable food, and perishable food doesn't pack well in prepackaged boxes. So we sort it right hours before, we refrigerate it, and then we hand folks refrigerated boxes, and that's been kind of wildly popular with families that are coming through. So about 1,000 people a day have been served that way. And then also just because we get calls from somebody that says, hey, I can't go out, I don't know where a pantry is, I can't find someone to go for me. We do have a program where, working with another church that will just take, the drivers show up and they'll take 5 to 15 or 20 boxes out to individual home addresses. So we can make that work if people need that to work. And I think other groups are doing similar things. One thing that's the opposite of a challenge, it's worth noting, is, this has always been true, but maybe more than ever, or maybe I just need it more than ever, need to see it. And it's the incredible generosity of our community. It's honestly, about every other day I cry on the way home. And it's because I just feel, deep fatigue, but also true appreciation for food donors and money donors, but honestly, even more just people who have high levels of compassion. It inspires me that, St. Joseph's Catholic Church would, because I know you guys look at this from a spiritual perspective. This isn't just some social requirement. This is, kind of the calling of God to care for people. And I share that perspective, and seeing that lived out in kind of big, new, tangible ways, and hearing the stories of people in need and how others have come to their help has just honestly been remarkable and life-changing for me. And so I don't know that I'd call that a challenge. I just would call it a kind of a rich opportunity that I've seen. Last question, how can people in the community better support? There's all the normal channels and things, and I love the question. I love the spiritual motivation behind it. And honestly, I think it's just, continue to resource and give. You're all doing that, or you wouldn't have tuned in today. But I think it's also to be advocates for care, to be advocates that it's right to help others. Nothing is done perfectly right now. We make decisions on 20% of the information we used to have, and we just hope that they're the right ones. And kind of having the mercy and forgiveness of people along the way to say, hey, that's less than perfect, but let's keep going forward, honestly is really, really helpful. And David, people like you and the rest of the guests here, are committed to that, and I know your church as well. And honestly, just stay on that course would be beautiful to me. So thanks for giving me a chance to speak.
Sure, Alan, that was great. Yeah, what you said there.
I have a neighbor that's firing up his lawnmower, so I don't know if that was distraction. Okay.
No, I couldn't hear it. So yeah, no, I've got a lawnmower in the back going too for this nice day. That's kind of what people are excited to do after some rain. But yeah, I really appreciated what you said, Alan. What you said reminded me actually of today's gospel. In the Catholic tradition, it's the road to Emmaus story, where these disciples encounter Jesus on the road. They don't recognize him, and then they start telling stories, and then they break bread together. And for folks in our communities, it's been a struggle to not be able to gather and to worship together and to share communion together. But what you were saying there just made me think about the ways that we can take the Eucharist and put it into action, because really that's in the Catholic tradition, we look at communion as an action, not an object. And so this time has forced us to really focus on the action part of communion and not the object part of it, of actually.
Wow. It's great. And I love that story. The disciples that were with him were filled with wonder because they had seen something that they didn't understand and couldn't explain. And I think that's part of the wonder I was talking about that has really been inspiring to me.
Yeah, for sure. Thanks, Alan.
Yeah, you bet.
Diane and Amy are here with Share. So I'm going to turn it over to the two of them. They're going to talk about what's been going on with Share. Thanks for being here, both of you.
Business as normal at Share, because of course all of our services are essential and they have to go on. But I will say, I'll echo what Alan was saying. The days are a lot more full and a lot more exhausting for everyone, not just our staff, but those that are supporting us as well. For our shelters, thanks to the support of St. Andrew Lutheran Church, Share has been able to continue to shelter up to 30 guests in the winter hospitality overflow. And we've been invited to do so through May 4th, which is, as you know, the governor's decree that we'll see if we go back to normal on May 4th or not. So we have continued to do also the overnight mats in our dining room at Share House. So we continue to support more men there. And we have expanded, thanks to a grant from the city of Vancouver, the women's shelter from an overnight shelter to 24/7. And that has been really fantastic because, as you can imagine, it's very difficult to put people out in the morning knowing that there is absolutely nothing open. There isn't anywhere they can go that's open. Our hunger program has definitely seen the biggest impact. We've changed our cafeteria at the Share House with our hot meal program to meals to go. And so that takes a lot more time and preparation. And of course, as all of the other agencies have also spoke about, we're doing it without volunteers. So non-essential staff, such as those from the development department and the volunteer department and admin, are supporting making all of those meals to go. And we saw a tremendous increase from February to March. The numbers doubled, and they are continuing to go up and level and then go up and level. I think it just kind of depends on the day, but we're putting out a lot of meals to go at Share House. And we continue to partner with Evergreen and Vancouver School District to get our backpacks of food out to the children in need. Again, we're doing it without very many volunteers. So what used to take 50 to 60 volunteers an hour and a half to accomplish is now being done by about 2 or 3 volunteers and staff. And it takes about 5 to 6 hours, but we're still getting those essential food for the weekend out to the kids. We definitely appreciate St. Joseph's giving us the ability to use your kitchen for our summer meals program. So we're planning now to continue that and what that will look like in this summer of different times. So we'll see how that goes, but we're very grateful that we'll be able to do that using the St. Joseph's Kitchen. Thank you very much. Our housing program is pretty much the same, other than we're not doing as many home visits as was Teresa from St. Vincent de Paul saying. We are doing some, and when we do, we wear face masks, gloves, and booties, and do wellness checks and case management with some of our clients. But most of that is occurring on the phone. We continue to get people into housing, which is rewarding and exciting in these challenging times of finding landlords that are not answering their phones, or you have to set up an appointment. And our outreach program is continuing as normal as well. They're out on the street distributing their hygiene kits and their meals to go, and doing harm reduction through the needle exchange program. So SHARE continues pretty much to do the same as what we were doing before, only in more challenging conditions. And I'll let Amy talk about some of those challenges.
Thank you, Diane. Yeah, our biggest challenge has been battling anxiety, that our clients have anxiety. And while that isn't exactly unnormal, everybody's anxiety is heightened, and certainly it's very valid that people are concerned that they don't have as many options of where to go and how to be able to meet those needs. What's new and different is that our staff also have anxiety, and they have pressures from their friends and family about the work that they do and how they do it. So we're trying to adapt to that. And it's really our goal to just be as creative as possible. So we are open to suggestions of, we have an idea of how we can still provide services in a way that's safe. And if that isn't working for our staff, then we try to figure out what their ideas are so that we can do things better and help to keep everything going. But anxiety has been our biggest challenge, about who has it and when they have it and how quickly they move through it. And then fortunately, those people are also there to be supportive of the next person who has moved into a place of anxiety. It's an ongoing anxious time. So we have that. And then as Alan mentioned, it's been access, that we're used to living in a world where we can get our needs met rather quickly. And that hasn't been our new normal. So then it's about trying to figure out who has what we need, and is there a more creative way to get it than we're used to, of just ordering online or going to the store. It's finding those different resources to be able to do that. It's been an ongoing challenge for us. Back to you, Diane.
Well, and wrapping up with how the community can get involved, we do obviously rely extremely much on volunteers. And if a volunteer in the audience is healthy and able to join our agency and support us, we use masks, we keep social distance from one another, and we use all the safety protocols that anyone would want to implement. But we do need volunteers down at Share House to potentially put the meals to go together. And then we also need people to help us put those backpacks together. If a community member is not among the health vulnerable, then we would definitely appreciate hearing from you. There's also opportunities for people to do things from home. We have permission to use some t-shirts that we received from A to turn into face masks. And we can deliver a box to your porch that includes everything you need to put those together, including the instructions. And all of the agencies in town are needing to use face masks over and over again and wash them and keep them safe. So that would be great. This is a very challenging time. And I would just say that another way to keep involved and be an active person of the parish is to reach out to the other parishes. And I know Father Gary mentions that every Sunday, but I think there's a lot of people that are suffering from anxiety. We're seeing it in our own staff and clients, and I'm sure it's in the parish as well. And so just reaching out and talking to them and seeing how they're doing is a great way for a volunteer to be active at this time.
Great, thank you, Diane. And Amy, I'm glad you brought up masks, because I've had that conversation with people. Is there a need for masks, and is that something, because that's something that a lot of people feel like they can do. They're at home, they have sewing machines. I had a parishioner make me one here, so very nice. And so I'm glad that there's a need and an outlet. So Diane, with your, you said the volunteer coordinator isn't coming in. What's the best way if somebody wants to volunteer with Share? Who should they reach out to? How should they get connected?
No, our staff are still coming into the office. They're working from home and working in the office, but the From Hold Center is not open to the public. It's the only one of our facilities that's not open to the public, but you can call us, either Heather or Molly, and make arrangements to receive the products, and we safely deliver it to your front porch, and then you can make the masks, and we can either pick them up or you can make arrangements to deliver them back to the From Hold.
Okay. Great. Well, thank you both for sharing. Now let's turn it over to Kate Budd, the Executive Director from Council for the Homeless. And Kate, tell us what's going on with you all.
Sure. Well, thank you again, David, and St. Joseph's Catholic for facilitating this conversation. It's a wonderful opportunity. I wanted to start just by sharing that our agency is a bit unique in that we range from having an on-the-ground, face-to-face engagement with folks still through a staff member we have who's actively doing outreach with all the appropriate PPE gear and remaining socially distant, all the way up to a 50,000 foot level where we want to make sure that as a system among all the agencies that serve people without homes and those who might be unstable in their housing are working together so that we're as efficient and as nimble as possible. So with that, starting at the 50,000 foot level, I, as Carolyn mentioned, have been facilitating phone calls with our homeless crisis response system providers, just to make sure that we are up to date with what's going on with the latest developments, and that we know, what are the most up-to-date facts that public health is sharing in the community, and how can we make sure that we continue to provide the needed information regarding COVID and resources to those that are experiencing homelessness and are unstable in their housing. The council is also working with a number of different churches to help support their efforts, including Living Hope, which is doing amazing things 4 days a week to provide showers through the Shower Outreach Project with Food with Friends. They also provide 4 meals throughout the week in partnership with Angels of God, and then twice a week provide clothing to folks without homes, as well as food boxes. We also work really closely with Emmanuel Lutheran, who is providing safe parking spots in concert with Go Connect and their safe parking efforts. We are also working very closely with Clark County Community Services and Public Health, and have worked with them to identify a motel that is now being used for a quarantine and isolation facility for those without homes who are affected by COVID in various ways. We are serving as the coordination hub between systems of care. So the jail, healthcare providers, shelter providers, outreach providers, who refer people that might need to be in that motel. And then we work with the motel to make sure that they arrive there safely and soundly and have a safe place to be while they recover from COVID or appropriately isolate if needed. We have created a really vast and kind of large scope website related to COVID in our community. And what it includes are one-pagers that provide information and facts for people who are experiencing homelessness related to COVID and how they can be safe and how to make sure that they're social distancing should they be living in tents with one another, or should they be worried that someone might actually have COVID. We also have a one-pager with all the different resources that are available to people experiencing homelessness, from basic needs all the way up to how to access the housing hotline and shelters and longer-term housing programs. We also have a pretty extensive resource page with different tabs that indicate how people can access whatever their needs might be, and certainly encourage anyone who hasn't seen it to check it out. We hope that it's helpful. Regarding direct service, we continue to place people in the many shelters throughout the community, as Diane and Amy mentioned, the shelters remain open, and there's actually more shelter space available right now in the community than there even was during the winter, say in January, for example. And I really applaud our shelter providers for continuing to keep their doors open. It's a challenging time for everybody. And when people can be in shelter, that helps to bring that anxiety level down just a little bit. To help facilitate additional beds for people in the community, we have been providing motel nights to those that are still without homes and are particularly high risk for COVID. So it might be someone who is elderly, who has diabetes, has some type of heart condition. The reality is that they're at very high risk for COVID-19. And so to move them into a motel where they can be safe and social distance appropriately is our focus there. On average, we've had about 80 households in motels through partnerships with many local facilities here in the community. And just a shout out of thanks to them too. Those motels are working overtime and are often completely full, thanks to many different providers in the community who are putting people into motels right now. We also are still providing rent assistance to those who have been affected either by a loss of income through COVID or may have need for rental assistance for other reasons. I was looking at our data, and just the first part of April, we provided rent assistance to over 40 households and continue to work as fast and furiously as we can to support those who are struggling to pay their rent. Thinking about the challenges that we're working to overcome, as Amy and Diane mentioned, unfortunately, there are fewer access points for those without homes to meet their basic needs in the community right now. And so we have been providing a bit of outreach in the community, just providing hygiene bags that might include a mask, soap, bottled water, sanitizers, so that we can help people meet those precautionary measures while they're precariously housed in our community. We also have created one-pagers regarding where people can meet their basic needs and have shared those on our COVID website in Spanish and English. We also are kind of continuing to live in the reality of a community that doesn't have enough resources to house and shelter everyone who has those needs. And so again, I'm so pleased that we're continuing to do more even during the time of this COVID crisis, but it is very realistic that someone who is seeking out shelter may not be able to get into shelter or a motel here in Clark County. In the Council for the Homeless, for our staff, we're doing almost everything remotely. And so that's given us an opportunity to research and adopt different technological measures. Carolyn mentioned that she's having to reach out to landlords and get leases. And so we've actually started just having landlords take a picture of the lease that the individual has and send it to us through text. And that's been great. We also now have a DocuSign account where we can send it to someone who might be unstable in housing. They can electronically sign the needed documents and send it right back to us so that there's no face-to-face engagement. We're also doing work just to educate people on related realities in the community. So the stimulus check, for example, how can we make sure that those without homes actually are able to get the stimulus check into their hands where it can be used, and helping to inform the community that one can still use the navigation center address, for example, if they would like to have their stimulus check sent there, and then keep checking in Tuesday, Thursday from 10 a.m. to 12 noon in order to see if they've gotten their check yet. We are also working on just trying to help people understand, how to access various needs that they might have, and again, connecting it to that COVID website. The next thing that I want to mention, Alan had said that the silver lining is that agencies are coming together, and I would echo that. We've seen agencies coming together in new and creative and very selfless ways throughout this entire process. The food bank, for example, is providing food boxes for the people that we put into motels so that we can make sure that they don't have to unnecessarily leave their motel in order to get food, many of whom have no interest in leaving and want to be able to socially distance. So that helps to reduce the barriers for folks and helps to make a connection with them to the food bank as well. So thank you for that. Regarding people in the community, how they can better support our work, I echo what's already been said. A few additional needs is if any church happens to be interested in being a safe park location, there is still a need for safe places for people to park throughout the community. And we have a connection with an agency called Go Connect and a gentleman named David Bilby who can help make that a reality if there's any interest. The Council for the Homeless, we have an Amazon wish list that's on our website that details different things that people can send to us that we'll use during outreach that people have indicated that they need. Cell phone chargers, a good example of that, as well as hand sanitizers and even masks. We also have a need in the community for additional restrooms and hand washing stations. The Washington Recovery Alliance just recently opened up what they're calling Fourth Plane Pit Stop off of Fourth Plane and Fort Vancouver. And that's amazing and wonderful, but unfortunately, it's not a convenient location for everyone who's experiencing homelessness. And so if there are churches in other areas that might be interested in providing porta potties and hand washing stations, feel free to reach out to us and we can help facilitate a connection with the Fourth Plane Pit Stop. Kind of bigger picture, helping to debunk stigma related to those who are experiencing homelessness is always beneficial. Unfortunately, I've heard some stigma that just isn't true. For example, that there's a large number of people in our community that are without a home and also positive for COVID. And that just isn't true at all. And so we want to help to make sure that folks have facts regarding those without homes in our community. And to echo what Alan also mentioned regarding advocacy, we do need additional funding and support for those without homes in our community. And that would then allow us to more effectively meet the need that we have here in the community. And so whether it's at the federal, the state, or the local level, that advocacy is needed. And then lastly, I always like to mention just simply being kind to people who are experiencing homelessness, especially right now. As Amy mentioned, the fear and that sense of crisis is real for all of us, including those who are without homes. And so it might make us a bit more irritable. It might make us, not want to engage with someone, but simply just sharing a smile, sharing a hello makes a huge difference, especially because there's fewer of us out in our community. And so having a positive interaction with one another can really go a long way for all of us. Thanks, David.
Yeah, thank you, Kate. So a couple of questions. So I was going to ask you, Kate, you mentioned Emmanuel Lutheran is doing the Safe Park. And I'm glad you brought that up, that other churches could do that, because I was thinking of Emmanuel Lutheran's parking lot, and it's not a very big parking lot. So I can think of a few other churches out there that have larger parking lots than Emmanuel Lutheran that could be able to do that. Are Safe Park locations important all around the county then?
It is important to have locations all throughout the county because we know that those without homes, especially living in their cars, are also throughout the entire county. And so we always check in to say, hey, which one that might have openings would be a good fit for you. And so, of course, if someone is from North County, to have a safe park where they can stay in North County would be ideal. So yes, throughout the county would be wonderful.
Okay, that's good to know. I'm gonna invite people who are watching on Facebook now to submit any questions that you have for any of our folks here. So go ahead and type them in the chat. I've got it open here. There's already one question. We're in a slight delay from what is actually live, so it might take me a few minutes to get to your questions, but to give people a chance, I've got another question back to you, Kate, again, on the restroom and hand washing stations. Is that something that like churches would again host like in their parking lots, or where would those
It
take
would
place?
be, yes, in the parking lot outside. There wouldn't have to be any access to the church itself. And because we have a church that's doing it right now, we do have a good template that we could connect them to.
Okay. And then in terms of the cost of the restroom, the porta potties and hand washing station, is that something that you would look for the church communities to try to help support, or how do those get funded?
We would, yes, we would look to the church community and potentially partners, and certainly could partner to share any philanthropic efforts that they might be able to tap into that could help make that a reality.
Okay, excellent. All right, so I'm looking at the Facebook live chat, and there's a question directed towards Carolyn in St. Vincent de Paul. The question is it possible to send groceries orders delivered directly to St. Vincent de Paul? And what day and time would be the most convenient for staff to do those deliveries?
Absolutely. We welcome groceries brought in here. Normally it's between the hours of 9 to 4 or 9 to 5 p.m. Our website indicates 9 to 3 p.m. I'm usually here after hours, so we would welcome that relationship, and Monday through Friday. So I would probably need to say 9 to 3 since that's my donation time, but it is only it's only food and hygiene that we can accept right now, or financial donations. So no clothing or no household items. Thank you.
All right, thanks, Carolyn. Let's see. Mike, I have a question. Just how many shelter beds are available right now for folks? I don't know if Diane or Amy or Kate, who's the best to answer that question.
Just a rough estimate, not having my paperwork in front of me, is there's about 350 beds community-wide, plus the motel vouchers that we're providing right now.
Great. Well, I really appreciate everybody making the time to be here. I got another question here. Would it be possible for groups to make food in their homes for the share house meals? So Diane or Amy want to tackle that one.
Well, unfortunately, things have to be made in a commercial kitchen, and then they would have to be kept at temperature. So I think it'd be really hard for us to accept that legally, but it's a beautiful offer. So we appreciate the concept.
Okay. So if somebody wants to help, would it just be donating the food products then? Would that be the best way for them to help?
Yes, and especially because most of the food we're giving out is in a to-go option. So then we would want people to be able to eat it at the temperature it was meant to be at. So we're just not doing a lot of hot meals right now.
Okay. It's a lot of sandwiches and cold meal.
And salads and cold pastas, that sort of thing.
Okay. Diane, did you have something to add?
No, Amy got it. Thank you. We also would be open to receiving donations of food being delivered either through Amazon or a local grocer here at the Fromhold, and that's Monday through Friday, 9 to 5.
Okay, excellent. All right, another question. Do any of the organizations have volunteer opportunities on evenings or weekends?
So yes, Share has volunteers for our hot meals on evening and weekends. That people would just need to check in with our volunteer director, and they could do that via email if they like. But yes, we have opportunities.
Same for Clark County Food Bank. There's Saturday food repacks, building food boxes, and then every single evening there's volunteer groups. We're kind of 7 a.m. to 8 p.m. on volunteers right now just to get the work done, but smaller groups. And that's just our website has the path that explains how to make that happen.
Okay, so that was a question I had for everybody is what's the best way for volunteers? Is it through your webpage? Is it through a phone call? What's the best way for them to connect with you?
For state
Or phone, either or works for Share.
Carolyn, what did you say?
just, I would refer them to our website to see our volunteer opportunities. My evening shifts would be normally home visits, but because I cannot do those right now, have volunteers go out to their homes. It's Monday through Friday during the day that we need our volunteers, mainly between 8:30 and 1:30.
Kate, how about you? What's the best way are you taking volunteers?
We're not, because things are being done remotely, but I will say on the COVID-19 webpage, we've worked to try to bring together all the volunteer opportunities we're aware of in the community, such as with St. Vincent de Paul or Share or the food bank, so that everyone can see what their options might look like.
Excellent. Let's see here. All right, so question is, if someone gets a voucher for a motel, how long can they stay?
It's all dependent on what's going on in that person's life, as well as the funding that's available.
Okay, I have a question that someone's hoping the conversation will be available to view later, and yes, the answer is yes. I'm recording this and we'll post it to Facebook, so you'll be able to see this later if you missed parts of it and came in late. We had a few technical difficulties at the beginning, but I think for the last 45 minutes ago or so, it's been solid. All right, question about the WHO. Are meals still needed at the WHO? I know they had sent out signups until the end of April, maybe. Does anybody know if you could still bring meals to the WHO?
Amy.
So there's a sign-up sheet on I believe it's for the WHO website for whether or not those are needed. We'll be there at St. Andrews through May 4th. But there has been a significant response from the community, so I don't know off the top of my head.
Okay, so go to the WHO website, see if there's any spots still available. Yes. Great. All right, and somebody sent in just letting people know that at the Fourth Plane pit stop, there's an option for volunteering there. So if people are looking for a volunteer opportunity, they're looking for volunteers there. And they mentioned earlier that they would love to have more of those, like echoing what Kate said, to have more restroom and hand washing stations around, because the idea is that it's for that local area. So we should have them in the different areas where people are. So the more churches that can host these, the less people have to move around at this time.
I might add one thing on the volunteering. A lot of volunteering that we have at the food bank is easy, low training, and you can make an impact within a couple hours. And then there's other volunteering where it might take you 2 or 3 hours to be trained enough to be meaningfully useful. So if a volunteer could say, hey, I think I could come 1 day a week for 4 hours for the next several weeks, that would be of greater value to us, and we could assign you certain projects where we've trained you in how to inspect food for safety issues, or how to sort it according to, different food safe categories and that sort of thing. So even though the website is the right portal, kind of noting, I could help more than just once, or I could help on a regular basis, I think probably for all of us would have greater value, especially during this time when many of our well-trained and faithful volunteers are not able to come in. We're kind of, wanting to backfill at least temporarily some of those little bit higher skill areas.
Great, thank you, Alan. And I had somebody that came in late who is wondering again about at-home volunteer opportunities. So we just reiterate them, share about the mask making, any other opportunities that people who can't go out and serve but still would like to help.
David, could I add something to that?
Certainly, yeah.
My lunch bag program, if someone was at home and took my sandwich bags, napkins, my forks and spoons, or sometimes I have knives and spoons, and just pre-packed those up and brought them back to me all sealed in my little Ziploc bag, one of those packets goes into every one of my lunch bags. I mean, it sounds small and maybe not important, but it's very valuable if you're in the community and you have a salt and pepper packet, or you have a napkin or a spoon to eat your, yogurt or whatever I'm able to put into a lunch bag. But that would be really valuable, because oftentimes we're quickly making up a lunch to go out the door to some of our homeless that are coming up. They can't take a whole food box. They don't have anywhere to cook and keep things, perishable items refrigerated. So we send them with that. And those extra steps, if I have a big box of those all pre-made for me, I would love for our community or someone at home to make that for me.
And David, also at Share, obviously we're doing our backpacks of food for weekend food for the children. And what we're doing, because we normally use shopping bags that are recyclable and you use over and over again, but since we're not at a place where they can bring them back to us, and that's not really a wise idea under these situations, we're using the plastic bags. And because of the weight of the food, we're doubling those. So volunteers at home could double the bags and knot them up and then bring them back, and we could use them by filling the food. So that's another opportunity at home.
And Diane, can you just mention again how people can help with making the masks, just for people who came late?
Sure. We were gifted a number of t-shirts from A. And so there's actually instructions on how to turn a t-shirt into face masks. And so we would deliver the t-shirts and the instructions and the material in a box, and we leave it on your doorstep at a prearranged time. And then you have it at home to make those masks and get them back to us when you have them done.
Yeah, that's great. Thank you. All right. Question about, would decorated paper lunch bags be helpful to anyone? For example, decorated by kids.
Oh, that's so sweet.
We would love them.
You could use them, Carolyn?
Absolutely. During the Thanksgiving food drive through the 4 local parishes, the children at some of the schools decorate our Thanksgiving food boxes or bags that go out. And the clients, especially our homebound, when they receive them and there's a decorated turkey or just beautiful saying on it or children's art, it brings a smile to their face. So I would welcome those in my lunch bag program.
Great. And then Diane, back to you. Somebody just asked about how do they contact to do that mask making or home volunteer work?
No, I should have the number. I'm going to give you my number. If they just call 360-952-8216, I will make sure that they get connected with Heather or Molly, who are our volunteer department, or they can look on our website, has that information as well. But any of those contacts here at the Fromhold Service Center could make that happen for them.
All right, that's great. Well, we're almost at an hour. It just flew by for me. So I want to thank you all for taking the time on a Sunday afternoon. I know it's not a normal work day for any of you, but it meant a lot to our communities at St. Joseph and St. Thomas and Camas to have you all here, to give us a real-time update about what all the good work that you're doing and the ways that we can support you in that good work. So thank you for taking the time for being here today.
Yeah, thanks for caring. Thanks for reaching out.
Yes.
Thanks for having us.
David.
Yeah, glad to.
Thank you, everyone.
We'll be in touch soon, and you know, the landscape's ever changing, so we might have to do this again to see how your work has adapted yet again.
No problem. Thank you.
All right, take care.
Okay, bye. Thank you.